Hi, my name is Ellen Shi. The video I'm going to practice today is video 1, ICE. When my clients and I are doing the prenatal preparation, they always like to ask me what position I need to practice. I can have a smoother, quicker labor, or what pushing technique I need to learn in advance so I can push quicker or more efficient so I can deliver my baby faster. So all these are the things we actually would like to know and would like to learn. But today I would like to also introduce you the things we don't really look, which is under the surface of the iceberg. If you look at the iceberg, we have the visual we see above the surface, above the sea, and then the portion under. So the portion under, I would like to share with you the ICE BRB foundation, also the foundation for the birth. I stands for the inner work, how your brain thinks of things and thought and how you feels, and also C stands for communication in yourself and with the partner and with the whole support team, and E means education, like soft knowledge you need to learn how to communicate what Pitocin is, and then hard skills like versus movement or partners massage techniques. Okay, ICE stands for inner work, communication, education, and flow state is a state that if we enjoy something, we feel proud, we feel confident, and we like to keep doing it. Is we call it simply flow state. You are in the vibe, and then you are in the pace of your mind and body. So when we apply the flow state into the birth, that's why we call labor land. Is you enjoy what you are doing, and then you are proud. So for example, you're practicing certain body movements that your body leads you to do, and then you feel like, oh, this is what I'm doing it, and giving birth is, I'm enjoying it, and I like to do these things. So this is the labor flow state. So giving you an example of my client, Angela, she's a first time mom. Her water has broken. She agreed to have a medicine to help her soften her cervix, and then so she has one cervical check. So 4 hours later, nurse performs another cervical check without her consent. It was very, very painful. And then she cries, and then she gets very scared. So let's use Angela as an example that look at her ICE. Her inner work, she was very scared and she was afraid to ask questions. She was also very confused. And then communication, she did not have enough time and she was so afraid to ask questions. She thought cervical check was everything necessary because she was in the hospital. And then for her education, she actually had education. She knew if she has no um, strong contraction, cervical check could be discussed. It's not necessary. And she also knew frequent cervical check will increase her infection rate. But since her ICE wasn't equally strong and then it happens too fast, so she couldn't really communicate and then work on her ICE, work on her inner work. So when her labor gets interrupted by the cervical check, her labor flow wasn't flowing anymore. So since the event happens in pace, impacts her labor pace and also impacts her and her partner's flow. So this is Angela's ICE. So I would say, why is the foundation? Because if you have a strong ICE or your ICE stays equally important, equally you apply for, you can stay in the labor state easier. So regardless how you go into labor, spontaneous or it is an induction, you can still um, in the flow and then in labor. So even the birth plan is not go with your plan, but you can still go with the flow and be centered and stay calm and be flexible. Okay, and thank you for listening. This is my video 1, and then retry. I hope this is better. Thank you. Bye bye.